And welcome to the Chaska City Council meeting. We are on Zoom tonight, so this is Monday, November 30th, 2020. We'll call the meeting to order at 7:02. And with that, I have a little script that I need to read here. Welcome, everyone. You might notice the meeting looks a little different. Due to COVID-19 pandemic, we are holding our meeting via video teleconference because the City Council has declared a local emergency for COVID-19 pandemic. State statutes allows us to hold our meetings remotely. Even though we aren't meeting in person, we want to make sure you can participate. If you have joined the Zoom meeting, you will notice that you are muted. We have a moderator on the call who will unmute those who wish to speak during the public comment portions of the meeting. Public comments will be reserved for visitor presentation, public hearings, or special circumstances determined by the council. Once we reach those parts of the agenda, I will ask if there are any public comments. If you wish to speak and have joined the meeting by computer or tablet, please click on the participants on the bottom of your screen and then select the raise your hand icon. If you wish to speak and have joined the meeting by phone, please press *9 to raise your hand. Once your hand is raised, a moderator will announce your name or phone number and unmute your line. Please remember that public comment is provided at the discretion of the council and is meant to provide productive discourse on topics related to the city of Chaska. Speakers shall refrain from comment or behavior that is deemed disorderly, derogatory, obscene, indecent, or off topic. Any person engaging in such speech or action may be muted or removed from the meeting. If you are watching online or on Comcast Channel 15, please be aware of the following. Our council members, city staff, and presenters are participating in the meeting remotely. There is a delay between the live meeting and the online cable broadcast. All council actions will be taken by roll call vote. Thank you. All right, with that, we will stand and do the Pledge of Allegiance. Mike, now I need the flag.
There we go.
Perfect. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thanks everyone. Welcome to the meeting tonight. Nate, will you please call roll?
Yes, Councilmember Wong.
Aye. Here.
Councilmember Hatfield.
Here.
Councilmember Hubbard.
Here.
Councilmember Grau.
Here.
Mayor Winchell.
Here. All right, moves us to item 4, adopting the agenda. Corrections or additions to the agenda? If not, I would entertain a motion to approve.
So move.
Second.
Oh, so that was that, Councilmember Wong and Councilmember Hubbard?
Yep.
Wong, Hubbard, okay. Discussion. Hearing none. Councilmember Grau.
Yes.
Councilmember Hubbard.
Yes.
Councilmember Wong.
Aye.
Councilmember Hatfield.
Yes.
Mayor Winchell, yes. So it passes 5-0, and we will move on to visitor presentation. Tonight we have Dr. Richard Scott from Carver County Public Health is joining us tonight, and he's going to give us the latest update on the COVID-19. And before we start, Dr. Scott, I just want to say thank you for all your willingness to meet with us regularly. I know you've been at our EOC meetings on a regular basis and always keep us informed and keep us up to date. So greatly appreciate all the work you've been doing. I know it's been a crazy time. I don't know that anyone can really explain everything that's been happened over this time period. So thank you for all your efforts. And with that, I'll turn it over to you.
Well, thank you, Mayor Winchell and members of the council. I appreciate this. It's an honor to have an opportunity to update the council on what's happening in our community as it relates to the pandemic. Obviously, this has been unprecedented times that we've seen over the course of the last 8+ months now, I think, moving on 9 months. And obviously, even just the last couple of weeks have seen some unprecedented activity as it relates to the pandemic. So I am going to share my screen for people and hopefully, so here we go.
Yeah, it's working.
Here we go. All right, good.
There you go.
I do have quite a few slides, but I will be going through many of them fairly quickly. I sometimes have a tendency of speaking a little too fast too, so feel free to ask me to slow down if I'm going too quickly. But hopefully I'll get through the bulk of the slides within 15 or 20 minutes or so, and then we can have some time for questions and answers at the end. But I'd like to start with sort of the national situation because I think it sets a context for us. And then I will share a little bit about Minnesota, and then we'll get into the specifics as what we're experiencing here in Carver County. I think obviously if you've been watching the news, you realize that there has been significant increases in cases over the course of the last month or so. We're beginning to see maybe a slight dip down, but we're not sure if that's really a reporting delay due to the Thanksgiving kind of break, which I think some of us think. So we'll see if that decreasing trend continues. Otherwise, many of us are suspecting that we're going to see another super spreader event from Thanksgiving. Based on what we've learned about how this virus spreads, it often spreads mostly within small gatherings of people, often feeling that they're not at risk with each other, but many asymptomatic folks will then carry it, and then they obviously then spread it to others. And that's where the good majority of the spread has been happening across our community. So we do anticipate seeing another outbreak due to the Thanksgiving week. I guess it all depends on the level to which extent people curtailed their time together. And I know it's really hard to do that. The deaths, of course.
Dr. Scott, if I could,
Yes.
a question that I get asked the most, you kind of led into that a little bit, that it's most contagious in small groups. Is there any explanation why one family member can have it in a household, be sick and not healthy, and the other member doesn't get it at all? That seems to be the number one question that I get asked about. How is it if it's so contagious? How is that happening? And I don't know if you got an answer, but I don't know if you can add any insight to that.
Sure. Well, I think you're right in me not having the definitive answer. We're still learning a lot about COVID because, again, first of all of us are at risk, but there are certain individuals that are more at risk, often associated with either age or comorbidity. The why someone can have it in the household and others not get it is still a mystery unless they've done a really good job of sort of maintaining their own space. Often what will happen is that one person may get it and get symptoms, the other ones will contract it but maybe be asymptomatic, and that could be due in part because their immune system is different and thereby may not be as sensitive to that this particular virus. But it's hard to know who's in that situation, and that's what makes it so difficult. But obviously the reason why it spreads in small groups is because you're together in close contact for an extended period of time. Often during celebrations, there's excitement. There may or may not be alcohol involved, but usually there's excitement. People start talking louder, more boisterous. Sometimes there's other activities. There's usually hugging and other closer proximity. And so you can see how then COVID would be more apt to spread as a result of that. And then if you're not aware, and like we've been hearing, is that obviously there's a percentage of people who are asymptomatic, or maybe it's pre-symptomatic, and then they're at risk of spreading it to others, sometimes unconsciously. And we never know who then is going to be the vulnerable one. I think many of you may have heard the story already from Superintendent Devine of Waconia Public Schools. I've shared it in a couple of venues, and he's given me authorization to share his story. But we were meeting with the leadership team, deciding on how to move forward when we first started seeing the exponential growth, and we were considering moving to a more restrictive learning environment. And very soon into the meeting, he apologized for what he was wearing. And he says, well, right now I'm in the waiting room at St. Cloud Hospital, and I don't think my father-in-law is going to make it. And sure enough, he passed away later that evening from COVID. And just a week before, he was active, vibrant, healthy. No reason to suspect that he would have necessarily been any more at risk other than older, but nothing, probably not too much older than, me, probably a little bit older than me, but so that you just never know when it's going to happen. And so clearly we all are potentially at risk. So that is an ongoing concern. And obviously, as you see new numbers occur, you're going to see a correlated increase in hospitalizations and ICUs, and then of course with that death. The other thing I think it's important to realize is that deaths are what we often talk about, but we still don't know what the long-term effects can be from people who have struggled with COVID-19. My wife is a nurse at a large metropolitan hospital, and during the summer, they had about one unit that was about half full with COVID patients. Now there's 3, and she is getting stories from people who got the disease back in May, April, June, who are now back with cardiomyopathy because she oversees a cardiovascular unit and then has a COVID unit within her unit. And then she's had people as young as 20, who are athletic and now coming back with that, who may not be able to compete again. Others that are in their 40s and 50s who are coming back with secondary concerns. And I know when talking with Superintendent Devine, and the last stages of his father-in-law's passing were not pretty. So there's a lot of those other factors we don't always consider that we're still unsure about with COVID. So that's the other concern that we need to be mindful of. So what's happening in Minnesota? I think Minnesota now is finally caught up with what's happening around us. Minnesota used to be an island within the Midwest area with what the highest rates were all around us: North Dakota, South Dakota, Wisconsin, and Iowa. Well, it's finally caught up with us now. And so that's why we're beginning to see this exponential growth. And there's widespread community growth. And as a result of that, it's hard to contain it because we're never sure exactly where we're going to catch it. And at that point, you sort of begin to have a hard time knowing how best to control it. And I think that's where we have been as well. And Carver County is no exception. Carver County was an island among its surrounding counties who had a higher rate, but now it clearly has caught up with us as well. This next one shows, I think, the real alarming concern, which is the hospitalizations, the top one being non-ICU, but the bottom one being ICU. And so with that, we will definitely experience more deaths as a result of that. Deaths are obviously a later statistics. ICU is a later statistic from hospitalizations, and death are later statistics from ICUs. And many of you may have heard on the news, but Friday was actually from Wednesday, but it was reported on Friday. We had 101 deaths. That's the most single day death count that we've had since the pandemic started. And I wouldn't be surprised that we might break that here within the next couple of weeks. We'll see. So that obviously is alarming, with a 35% increase in just a 2-week time frame. So clearly a concern. When you look at who's getting it, well, it's across the whole spectrum, but the highest number of are people in that young adult area right here. And they're also the ones that are probably most at risk for spreading it because of lifestyle. And also they're probably least apt to have negative outcomes from it. So there is the sense that it's not going to hurt me. And so combine that with their normal way of living and gathering and connecting and going to bars and restaurants and socializing really does contribute to the spread, because they all know other people who are older or more vulnerable. And also that it's often associated with sports in that area as well. The testing in Minnesota is one of the positive things. We have done more testing than what he anticipated. I think many of you may remember when the governor was shooting for 5,000 a day. And as you can see here, we've had up to 60,000 a day, considerably more than what we have. And what's good about that, while the testing itself doesn't cause it to go down, it does give us a more accurate picture of where and why it's happening. That allows us to do better planning and mitigation strategies. The increase in cases, though, are not due solely to the increase in testing. If that was the case, we would actually see a decrease in the positivity rate. But while the cases were increasing, the positivity rate was also increasing, and almost at a faster pace, which means that the real reason why we're seeing more cases is because those cases are actually out there and we're just finding them, and not because of the testing. Now we see a little dip down here, so we'll see what happens. But again, a lot of us think that might just be a reporting artifact from Thanksgiving. So moving on to the county, I think we are now following a similar pattern to what the state has been. As you can see, our increase of 7-day average increases is considerable. Again, this is the same statistic that the state uses for the safe learning plan, but this is a 7-day average instead of 14-day average. So it's a little bit more real time. Again, it started to dip down a little bit, which is good, but we'll see what happens if that continues to be the case. Our number of deaths, though, has been a concern. We've been fortunate that we've had fewer deaths per population than what we see across the state. But in the month of November, we had almost half the amount of total deaths that we experienced since the pandemic started. I remember you may recall the article that came out when our first person who passed away from COVID, who was in the 50s. There's a big article about that. Well, from that to now, we had 7 in November, and it took almost that many months to get to that same. So that is a concern, and is reflective, of course, of the number of cases that we've had. This is the graph of the official 14-day case rate that schools use to begin their conversation on what safe learning model they're to use. When we were meeting with Superintendent Devine and many of the other school districts a couple of weeks ago, at that point, we were still under the 30 mark. And we said, well, based on our real-time data, I would suspect that we're probably closer to 70. And now looking at this graph, that's exactly where we were. And we said within a week or two, it's going to be over 140, maybe 150, and that's exactly where we are. And keep in mind, 50 is the cutoff for all K through 12 going fully distant learning. And so we're 3 times that rate now. And almost all of our public schools and public charters have adopted, if not a full distance learning, almost a significantly distance learning. Some of our private parochial schools have been resistant to that, and that is a concern. We as a state agency don't have much leverage there, and we can understand their reasoning for not modifying their practices significantly, but that is a concern because that's where we're seeing a lot of our spread now is happening in those private parochial schools that have not moved towards more of that distant learning model. Again, the tests have also increased for us too, which is good. And yet we're still finding people having a hard time getting timely tests. So it's still a concern, even though our numbers of tests have really gone through the roof. And what was fascinating to note that last week, 5.5% of all Carver County residents got tested within that week. That is amazing. I mean, to have that much of our residency, our population, participate in a single request in a week's time is really phenomenal. I think it just really shows the potential of our residents to respond to what's being called for if they're motivated to do it. So that was remarkable. Again, our positivity rate, if you recall, anything above 5% is considered a concern. In order really to see a reversing in the trend of spread, it has to be under 5%. And here we're 3 times that amount. So again, if the cases were only due to increased tests, that would have gone down below because the denominator would have gotten bigger. But in this case, it's actually increased. So that is obviously why we've been so concerned. So the other thing I wanted to talk about, again, is just how does this impact us in other areas? I think we've been hearing a lot about the concern about how COVID has impacted us with our jobs, impacted us with our relationships, impacted us with our other activities. And a lot of times it's those activities and relationships that help us keep us emotionally and mentally healthy. And those things have been challenged, making it more anxiety producing, also not knowing exactly if we're the ones that are going to get it or what's around the corner, which further adds to our stress. And there have been several studies that have looked at this. A study that was done between October 28th and November 9th showed that 36% of Americans exhibited symptoms of anxiety or depression. So 1 out of 3 of us. Minnesota was really close to the same amount. And that does represent an increase of what you would normally see in the general population as of a year ago. Looking across the age group, all age groups have increased in their reporting of anxiety and depression, but which is really interesting, look at the 18 to 29-year-old group, 51.7%. That's probably represents at least a 30% or more increase than what we would have expected to be normally. Women also, I mean, statistically, women will experience a slightly greater self-report of anxiety, depression, but the magnitude here is significantly. And that could be in part because they are dropping out of the workforce for a variety of reasons at a 4 times higher rate than men. It might be due to the types of jobs they have. It may be due to the role they play within the family. We don't know exactly all the reasons. I'm sure it's a combination of many factors, but obviously that is a concern. And then again, when you look at how does anxiety, depression weigh out with the different races, this just shows Hispanic population seems to be experiencing a little higher amount than others as well. Another study that looked at what was been the change since March, since COVID was really starting to we were really starting to take notice of it. Obviously it started before then, but that's when we were really beginning to take notice. And the proportion of emergency department visits related to mental health increased 24% for children, 31% for adults, for adolescents. And that's remarkable because the actual visit to the emergency room for everything else was decreasing because of concerns for COVID and other things. And here the mental health related visits were increasing. In August, a report in August showed that 55% reported increase in the past month of alcohol consumption. That's clearly one industry that's thrived during this time. And 18% reporting a significant increase. That's usually where there's moving from mild to moderate to severe would be considered that significant increase. And 36% reported an increase in illicit drug use during this time. So utilization of mental health services is an interesting story. When we first started going into lockdown and many services, both health and medical and mental health, were asked to sort of discontinue face-to-face, it took a while for many of the mental health facilities across the state to kind of gear up for telehealth. We were fortunate in Carver County that we were able to gear up almost within a week. But across the state, and of course, our numbers are included in this statewide survey too, but you can see as a whole, there was a significant reduction from January 15th, which was the baseline, to the middle of March, seeing mental health. But that changed rapidly once telehealth was launched and there were waivers put in place for reimbursement mechanisms for telehealth. And as you can see, it's almost completely rebounded. When you combine all of those factors together, before COVID, this was the number of services that were being provided. It dropped down to under 3,000 in March, and then it went back up by mid-May, and it's probably higher than that now. If you look at those numbers for Carver County specifically, and you compare this year from last year, you can see with therapy visits and medication management, it's significantly increased. Intakes and psych intakes, those are probably close to the same. But as far as the frequency of them being visited and seen and complying with their medications, it all has increased from last year. When you look at the number of calls that come in for 911 and or crisis, other areas, this is primarily service calls though to the Sheriff's Office. It does include Chaska PD though. These numbers do include you folks. And you can see the real alarming statistic here is with domestic violence. I just got done talking with someone today who over the Thanksgiving weekend needed to find a secure, undesignated location for herself and her daughter because being in an abusive relationship. We've seen a significant increase in those calls. A little bit of increase in mental health, but a lot of people are choosing not to reach out. So I think that's disproportionately low than what the actual concern people are experiencing, but that's an alarming figure. You see fatal accidents increased 25%, but because the numbers are so low, we're not sure if that's statistically significant or not. I'm not surprised it would increase, probably associated with alcohol use, but again, it hasn't significantly increased. Another concern about avoidance of care, 41% of US adults delayed or avoided medical care, including urgent or emergency type care. We think there may be several deaths associated that are not in our statistics because of people not getting in soon enough or delaying access to care. And of course, avoiding care has been even more prominent among certain population groups, those with medical conditions, African American, Hispanic, young adults, and people with disabilities seem to be disproportionately accessing care, which is interesting. You'd see that. So what does our future hold? I think, first of all, in spite of the fact that we've had lots of cases, less than 5% of our total population has been affected. That means the pool of potential candidates is still high. You've often heard about the concept of herd immunity, and we would need to reach at a minimum of 70% of our population being considered immune either through vaccinations or from recovering from COVID. We're a long way from that, which means that we still have a lot of potential pool of further spread before we begin to see this stabilizing. So that kind of gives us an idea of what our future could hold if we, if we don't get control of it, so to speak. The rate of increase for cases, I think, is significant. I know sometimes people have challenged me when I quoted the other day that we had a 320% increase in cases. And they said, well, when you have few numbers, you double it and it may be 100%, but still few numbers. We're talking about significant cases. It took us 166 days to get to 1,000, only 72 to get to 2,000, only 12 to get to 3, and only 7 days to get to 4,000. So you can see where this is going. I think this will slow down now as we start moving forward. But again, I won't be surprised if we get to 5,000 in a week or less possibly. Again, cases per month. I just gave this presentation 2 weeks ago, and this number on the right-hand side here with the projected amount, we thought conservatively we would exceed about 1,400 cases in the month of November. We had a much higher figure as a, as a potential, but 1,400 we thought would be a conservative number. Well, we've doubled that. These are actual numbers now. So what are some of the indicators that the governor uses? I think many of you are familiar with that, but one of the things that's used is what he calls these Minnesota dial-back dashboard. There's 5 indicators that sort of are used as a starting point to determine what the mitigation strategies need to be across the state. Throughout most of the summer, 3 of 5 of those were either in the caution or high risk area. But now we have 4 of them that are all in the high risk area. And the only one that's not is the number of testing, and I can show that in a bit. But here's the positivity rate. You saw the slide earlier at 13.8. It really needs to be below 5, before we can start to breathe easier. No pun intended there, I guess. The other areas are case growth. That's the actual new daily cases per 100,000 residents. So you can see that amount going through the roof. What's good is the amount of testing we're doing. And like I said earlier, that doesn't cure or reduce it, but it helps us have a better, more accurate picture of what's happening. So that allows us to be more thoughtful about the approach we need to take in mitigating the spread. And then the last 2 ones are new COVID and hospital admissions. Again, this red mark is what we considered high. We're still within our surge capacity, but hospitals now are beginning to limit other kinds of procedures. As I'd mentioned before, I know my wife, who works at a major metropolitan hospital, had about half of the unit was sort of filled with COVID during the summer. Now there's 3 units of that. And it's not just the availability of beds that's a concern. It's the availability of qualified trained personnel to care for those patients. I know they've already had to adjust the number of patients per nurse throughout the hospital systems because of availability, and that will continue to get worse as this continues to expand. And also with that comes sad stories. I know 2 really sad stories that I heard recently. One was an elderly gentleman that his wife had brought him into the hospital because of COVID, was hospitalized, ended up having to go in the ICU, but within a couple of days, the wife came down with it. She ended up experiencing it, had a worse response to it. She ended up having to go to Mayo, and she ended up passing away before the husband was able to fully recover ICU. And so here's this person who was recovering from ICU just to learn that the person that drove him to the hospital died before he did. I heard another story the other day where someone was admitted, and during the time of being intubated and of course being unconscious during that time, woke up only to find out that 2 of the other members of his immediate household passed away from COVID while he was in the hospital. I mean, these are heart-wrenching stories. So the reality of this is very real for those who are affected. But it's just weird how it doesn't seem to affect others and yet affects some of us. So what's our action plan to move forward? I know I sound like a broken record here, but clearly the evidence is becoming ever stronger of the efficacy of masks. Masks by themselves are not enough, but it's still probably one of the single most important things that we can continue to do well into the time we start getting vaccines to help reduce the spread. And here in this study showed that there was almost cut the rate in half by those communities that required a mandated mask wearing. This is another study that just shows the one-to-one comparison. The more people use masks, the lesser the rate of spread. And again, the other concern we have is that 8 out of 10 cases spread at locations where people gather in close proximity: bars, restaurants, and gyms. And then also what's not listed here is those small family gatherings where people are together, close range, for extended period of time. There's hope around the corner. I think many of you heard the news. Pfizer is if they didn't get approved today, I haven't heard the news yet, but it's going to be probably this week. Moderna is just around the corner, and there's actually a third one that's probably going to get authorized before the end of the year as well. And so out of all that, there's 13 that are in that phase 3, which is the final phase of testing. But look at all the other ones that are on the bench, coming up. So we're going to have lots of options for quality, safe, effective vaccines. But again, they are not going to be available for the general public probably closer till the end of March, early April. Hopefully, though, we'll be able to start vaccinating kind of those high priority groups, those that are critically caring for the sick, caring for the elderly, and those who would be vaccinated first. But even before the whole end of the year, there should be enough available vaccine to equivalent vaccinate 7.5% of Americans. That's pretty remarkable. So there is hope, but until then, we still need to kind of contain that through the other tried and true methods. So what can we do? We're really left of just controlling what you can control. Steps to care for yourself and your kids. Take care of your body, eat right, exercise, get plenty of sleep. The same things that we recommend for maintaining your health anyway is really especially important now with COVID, because that is directly responsible for you maintaining your immune system and dealing with your mental health as well. So we surely encourage you to do that. And again, try to limit the use of alcohol and or other drugs to self-medicate, because that ultimately just makes things worse. The other thing is to connect. We're social beings. While we may not always be able to be in person, we can do it other ways. I know one of the ways we celebrated Thanksgiving, we were hoping to serve as a host to our youth exchange student. We become sort of the second parents to him because he graduated from Waconia High School about 5 years ago. Ended up going to college here at up in Moorhead. We have sort of been his surrogate family until that time. And his mom had flew in from India a couple of weeks ago, quarantined for 2 weeks with the intent of coming to visit us, stay with us for a few days in Thanksgiving. But obviously with this most recent recommendations and the spread, we said we really couldn't do that, and they understood. But what we decided to do instead is to hold sort of a extended family Zoom call. And so we have family members living all over the world, and we all got on the Zoom call at the same time. We had people from Singapore, people from multiple states in Minnesota, and obviously our friends from India, all on Zoom, all at the same time. It was amazing. And I don't know how many total people we had, 14, 15 maybe. And then we just all went around a round robin, spent a couple of minutes updating us, and we probably got a better connection with each other that way than we would have ever had if we were in person. Obviously, still not the same, but there's no way that all of us could have been at the same place at the same time without that. So it's clearly important to take the time to connect. Obviously, taking breaks, take time to unwind, learn how to say no when you can, and do the activities that you enjoy, and make sure you spend at least some time outside. Get outside, walk. We're excited about partnering with your Park and Recs department to see how we can make more opportunities for people to embrace winter outdoors, learn to like something that they may have not in the past. But as a result of that, they'll get fresh air, exercise, and also will help with their mental health. Avoid necessary stressors. And one of them is just turning off the television, limiting your exposure to the media, especially when it's nothing but bad news. Obviously stay informed, but limit that. And that's especially important with your young kids. And then feel free to ask for help. And sometimes it might just be calling a friend. Other times it might need to be reaching out for some mental health professional help. It's sometimes something that we all need at some stage in our life. So feel, and again, I'm saying this to the audience, your listening audience as well. Make sure you feel comfortable to do that. We have some of the best resources for that here in Carver County. Obviously, feel confident to talk with your children. Be honest, obviously age appropriate, but don't hide the reality from them. They need to know that you can talk to them about it and that you're going to be okay, that you'll get through this. And then obviously those of us as leaders need to set the example by taking care of ourselves and modeling that for our staff and our colleagues. One other thing, I love this slide. It says, you need to find your happy place. And that starts with first, focus on what you can control. I won't go through all of these 16 areas. You have a copy of this presentation. You'll be made available on your website for your participants and your community listeners. But again, it is important to sort of make sure you're being attentive, not as a second thought, but as a high priority, scheduling in time to take care of yourself, because we want to be in this for the long haul. We want to finish this race victorious on the other side. We want to take those steps now to protect ourselves now so that we can have many more years to come in the future. With that, I just have a whole list of resources. There's national resources, state and local resources. Again, you have access to this, so I won't spend too much time on it. But there's lots of support out there for people to help them through this. And together we can definitely make it. So with that, I surely will open it up for other questions.
Questions for Dr. Scott?
And Dr. Scott, thank you very much for joining us and presenting again. Certainly appreciate all the work that you do, have done throughout the course of this, all the work you do during normal times too. One of the questions that has been on my mind lately was the concern about like hospital beds and staffing. A number of people said, it's, I hear around like, oh, it'll be fine. If I get COVID and I have to go to the hospital, I'll be good. They'll still make sure that, there's enough people to take care of me or whatever. But then there's that concern of like, well, there's a limited number of ICU beds. Physically, we're just capped at that. And, even they expanded under emergency circumstances, there's a certain number. Where are we at in terms of actual capacity, like within Carver County? And then the other piece of it that you alluded to is that there's also a staffing challenge too. So what's like a normal staffing model for a number of like patients per nurse versus where does it start becoming dangerous or tenuous, and where are we at related to that?
Well, it's a very good question, Council Mike. First of all, we're still well within our surge capacity of ICU beds. So, we have, I think, plenty of beds still to care for that. I think we're concerning where we're going. And if we continue this trend, we will have to look at other alternatives. But as far as the actual physical capacity, we have that. What's probably more concerning is the availability of quality trained staff. Part of the reason why we've experienced a significant death rate from COVID-19 than what we saw early in this pandemic is that we've just gotten better at treating. Now, we have had some therapeutics that have helped in that arena, but we've also had medical personnel that have gotten real good at fine-tuning their clinical intervention based on what their experience has shown them. It's not something that you can just look in a book. There's not an algorithm for cure. But it comes from that experience of boots on the ground, mind in the game that they've learned through experience over the time. And that's not something that you can easily transfer to somebody else or for somebody else to quickly pick up, which means that as those healthcare professionals get overly taxed and start to burn out, they're not going to be available to care. And therefore, other medical professionals who may not have had the experience are going to have to come in and fill in. And by definition, they're not going to do as good of a job. Not that they're not capable, they just haven't had the learning curve yet to do that. And as a result, we're going to probably see greater deaths because of our inability to respond to the same level. We'll still have the therapeutics, so it probably won't go back to where it was, but it's going to be a concern. But what you don't see is the heartache. And this might bring tears to my eyes. When my wife comes home crying because her staff are crying because of the stories that they've heard, and they're living with this, day to day out. And so they're seeing the trauma that it causes the families who are affected. The rest of us don't see that as much yet. Many of us are removed from it. But it's very real for those healthcare providers who are struggling with the day to day out. And so the mental toll on them, let alone just the physical exhaustion, is amazing. I mean, when we had our family gathering, my wife and I were the only medical people. Everyone else was like, oh, I've had time to organize and clean my house and paint. And my wife and I look at each other, oh, we'd envy the opportunity to have to do that. And so that's a section most of us don't see. And so that's the other reason why you hear a lot of nurses and healthcare people pleading to follow the guidelines that are being suggested, because Otherwise, we'll end up seeing you or your loved one at the hospital. So that's a real concern there. The other thing is that healthcare professionals, they're adaptable. They find workarounds, they find a way because they're committed to providing the best possible care they can. And so while there may be an average caseload for a daytime nurse in a relatively intensive care, not an ICU, but in other words, like a step-down unit, might be 4 patients per nurse. And now they're being asked to take to 5 to 6. So they're doubling a 25 to, 20 to 25 to 30% increase in caseload. They're able to adapt because maybe they don't spend as much time talking with the patient. They don't give the back rub. They don't do some of the other things that were important, but maybe not as essential during this time. And so they cut back. So they're able to adapt. And also many, electives are being put on the back burner. And one thing about elective procedures, if you wait long enough, they're no longer elective. And by that time, you might have lost the opportunity for early intervention. So there's a cost associated with that as well.
So,
Sir Mike, I don't know if that answers it.
yeah, I think it does. And I just had one follow-up question. So one of the things you allude to is that there's this burnout. And I've heard that in some, early on when the surge was in like New York City, there's nurses and doctors from other parts of the country flew there to help provide relief and support. But, now when it's across the nation, there's nowhere else to draw from. So, and I've heard that there's been challenges with retention of doctors and nurses because, they are just getting burnt out. And, when there's this emotional toll every day, like being in a war zone, and I hear that from people who are in the clinical setting. It's, are we seeing that same challenge within communities in Carver County too, where, we're having, retention challenges?
It's a good question. I can't speak to Ridgeview, which is obviously our primary hospital here, or speak necessarily what's happening in the clinics, but I think it's the hospitals where you would see the biggest challenge there. I know that Daryl was sharing last week on our Monday morning briefing that they would see a couple of, COVID-related cases in the emergency room, and now their emergency room has been overrun by COVID-related patients. So clearly, there's been a significant increase. And having to convert more than a single unit, multiple units to COVID units is another indication of that. I can't speak to the exact numbers though at Ridgeview, but I know that that's common across the metro. I'm assuming we're experiencing similar now. As far as being able to bring in, often as hospitals will often bring in travelers, right? That's the typical way they bring in additional help. You often see it if there's a nursing strike. The big nursing strike we had here about 2.5 years ago, they had to bring in travelers to sort of do the minimum care while they stroke. Because there sort of seems to be a shift. I mean, right during the summer months when things were getting hot, we saw a significant increase in cases in the southern part of our country. Now that it's getting a little cooler there, they can kind of go back outside, whereas it's getting colder up, much cooler here, we're having to go inside. So we're seeing the higher cases now happening in the Midwest area. So you're going to see a little bit of transfer of care. It usually isn't enough to make up the difference. But fortunately, some of the major hospitals were able to get some travelers in to help out. And that does alleviate the burden. That comes at a cost, however, a cost that the hospitals right now probably can't afford, but yet realizing it's something that they have to provide.
And one last question. So I promise my last one here. So I've heard of some people saying that, they're just trying to get the hospitals are claiming more diagnoses because they're getting more money per patient. Is that true? And what's the economics behind it?
I think the CEOs of many of the major hospitals spoke to this question, I think a week ago at the governor's conference, and they shared how much money they're losing. I mean, it's amazing how much loss of revenue they have generated. So the notion that they're making money off of COVID, from their point of view, is absurd. And the increase of reimbursement for positive COVID cases are often to help offset the added increase in PPE or other procedures that need to be done to offset the costs there. And it's lucky if it even comes close to breaking even. As far as reimbursement for physicians or other things for COVID-related diagnosis versus others, from what I've heard, that is just not true. That is not true. So there's no incentive for the healthcare industry to exaggerate the number of deaths or associated morbidity due to COVID. In fact, the reality is it's probably less than what's being reported is less than what's actually out there. And again, I've heard a couple of stories where a person actually had COVID, but they had another pre-existing condition and they were on their last few days of that. They did not consider that a COVID-related death, even though they had positive for COVID. But the physician clearly felt that the way the patient had died was not associated with the way a COVID patient would die. But if a patient who has an underlying condition, but yet is still healthy and would have many more years to live if they didn't experience COVID, but got COVID, and as a result of their precondition, they died, then yes, that would be a COVID death, but they wouldn't have died if they didn't get COVID. And so, they might have died sooner than somebody else without any preconditions, but they still had many more years of productive life left. And yet those were cut short because of COVID. That then would be considered a COVID-related death.
Yeah. Thank you very much, Dr. Scott.
Good questions. Thank you for those.
Anyone else for Dr. Scott?
I just had one quick. I tend to try to focus on positive things because my profession here tends to be a little bit of a COVID-related HR role right now. So I talk about COVID every day. I'm just curious. I started to see some reports about immunity. Originally I think the recommendation or the thought was 3 months immunity. I think there was a report out, I kind of saw different articles that maybe suggest that there's some longer immunity. I'm just kind of curious of what you're hearing or seeing and what is still the guideline for a general consensus of if you had it earlier, you're immune for, how long?
Councilman John, that's a really good question. And again, we don't have the definitive answer yet. I mean, we haven't even been experiencing this for not even a full year yet. So we will definitely learn. And there's always exceptions to the rule. Generally speaking, the common belief is that when somebody who experienced COVID enough to have symptoms has recovered from that their immunity would at a minimum be at least 90 days or 3 months, but could be as long as 8 months. We just don't know if it's longer because we haven't been around long enough yet. I mean, so and then 5 months they thought was sort of going to become the average. And yet there was still enough people that were coming down with a new case, not a resurgence of the old, but a new case of COVID before that time. So then it's okay, well, so they scaled it back again for most policy related reasons for the 90-day rule. So typically for schools and other areas, if somebody has recovered and they're fine 10 days after the onset of their symptoms, for all practical purposes, they would be considered at low risk for either contracting or spreading COVID for at least 6 months. If they, except in this case for 90 days. So in other words, they say basically it's not really a get out of jail card, free card for 90 days, but basically they can go back to work, they can go back to their activities for 90 days. There have been exceptions to that. And so if they're going to be visiting a family member who's at high risk in a nursing home, you would want to check with that nursing home to see what their policy is there, because it's not absolute. It's good enough for the vast majority of our work. And so we have to weigh the risk balance of everything, because obviously not going back to work creates its own cost and suffering. And so we have to balance all those things. So 3 months is still the guiding rule. There have been some studies out there that may think it's closer to 8, and that's hopeful because it's studies like that help also give further credibility for the value of the vaccine. I think most experts will think that it's probably going to be similar, though, to the need to have annual boosters, much like we do with flu. Even though hopefully we would know with flu, of course, it's a different strain every year, but with COVID, we would know, and there might be a need for a frequency of boosters. We just don't know that yet. The 2 new vaccines that are coming out, they're both 2-dose related vaccines. There are some doses. Johnson & Johnson is doing one that's only going to be a single dose. But the 2 doses ones will achieve close to 90 to 95% efficacy for a period of time. We just don't know how long yet. Does that answer your question, John?
It does. Thank you.
Anyone else?
Yeah, you kind of touched on a question that I had in regards to people that have previously had contracted COVID, and with the vaccines rolling out, were they, needing to get that? And it sounds like kind of by your answer, that's still a yes, kind of in order to.
Councilperson Taylor, I'm not sure. Can you repeat the question? Are they needing to get a vaccine even if they recovered?
Yeah, so if someone has recovered from COVID, when the vaccines start to roll out, is it still encouraged to go get one?
That is a good question. We brought that question up just last week. We didn't come with an answer, and unless there's some new information out there, I do not have the answer to that. That is a very good question. Typically, there's not harm in getting a vaccine for something that you've already may have immunity to. Typically, that's not the case. And I'm assuming that would be the case here. We don't know that for sure. But when you have a limited dose and a limited availability of a high value vaccine, then the question is, would it do more good to give it to somebody who hasn't successfully recovered? Because a person who's successfully recovered at least has some level of immunity, therefore would be more apt to be protected than someone who didn't. And then the question is, do we want to use up a vaccine right now for that person when it could go to someone else who hasn't recovered?
I had a couple of other questions. Testing. So, testing is, like you said, we're administering a lot of tests. I've heard a lot of, so as the cases have increased locally and statewide, the rate of getting those results back has slowed down. What is the typical turnaround time of tests kind of currently? And like a secondary part of that, where's the best testing site? What is the best method? I know there's a lot of different, there's the saliva test, there's, testing sites. What's the best for people?
That is a complicated answer because it depends. For the average person, the average resident who wants to get tested, whether either they're symptomatic or asymptomatic, there are several options to them. The saliva testing has been shown to be very highly accurate. And so that has a high accurate results, just like the PCR, which was considered the gold standard before. That's the nasal swab test. That's the diagnostic one that they use, although saliva now can be used for that purposes too, for the most part. Both highly accurate in its ability to determine whether or not you have it or don't have it. They all have false negatives and they all have false positives, but fairly positive. When the saliva testing went from a pilot, and of course, Carver County was one of 24 counties across Minnesota that are part of the pilot, you were able to, when you ordered, you usually got it within a day, 36 hours. And if you submitted it before the afternoon, before the UPS pickup, then they would let you know what the results were basically almost in 36 hours, maybe 48, I mean. Now, because it's been available statewide, there has actually been a shortage on some of the reagents and some of the supplies necessary. So it can actually be up to 5 days before you even get the test. Hopefully they'll catch up with that real quickly and it'll be a fairly quick turnaround time. The other option is if you can drive to what they call the no barrier sites, which are often provided with the support of the National Guard. And they're spread out across the state and they have permanent sites and usually 1 or 2 time temporary sites. And all of those are available on the county's website or on the state's website if you go under testing. And those usually have a 48-hour turnaround time. They're often using the mail, but they have kind of a high priority preference given. So if you can get in, those are usually pretty quick. Healthcare personnel often have reserved tests that are available for them. Some of them use a rapid test. Some of them use a traditional PCR test, depending on the need. And those usually also return back fairly quickly, but that's because they're given priority because they're a healthcare person. And so as a result, others would then sometimes have to wait. But that has been a concern. But what's amazing, when we looked at that earlier statistic, close to 60,000 people got tested. Whereas we were hoping to get to 5, right? And even in Carver County, we were at 5,700 in a week, whereas we used to be happy with 400. So the sheer number, and yet people are still wanting to get tested and we're still delayed. So it just shows that the need for the testing is still out there. It's hard to be real specific. So that's why we recommend kind of looking at a variety of the options. We try to keep our website up to date with where those testing options are. You're always welcome to call your doctor, because the clinics are also often doing testing for their own patients, not necessarily for the general public. There may or may not be a cost associated with that. There's no cost for the actual test itself, but there might be a cost associated with the clinic visit and the assessment if you go to your own doctor. And insurance, co-pays then may apply. The saliva testing is 100% free, no cost to the person, and the barrier-free testings, those are all free to the person.
I just want to comment. The one thing that I've heard, and I guess this feedback, right, is testing for asymptomatic people, like through exposure. I think that's been a challenge, continues to be a challenge. So, like I said, I alluded to my role. If someone's been exposed, we tell them they need to go get tested, and we quarantine them. And sometimes we're getting feedback that, well, I can't get anywhere. They're not testing asymptomatic. I have no symptoms due to exposure, even though the CDC recommends that if you have been direct exposure, you should get tested. So I think, you talk about testing those numbers. That's the area that I've witnessed in my career here as a problem. People are giving us feedback like it's not easy if you have no symptoms, even if you report direct exposure, to find a test. And so those are the struggles that we're hearing out there now. Again, as we keep ramping up, I think that'll improve.
And that's still the case. I think it is when it comes to testing that's provided by Ridgeview Medical Center or testing provided by your local doctor, unless you happen to be in one of those other groups. There is no restriction, though, as far as using the home saliva testing. The delay is just because there's been so many demand for it, and it takes a while for you to get it. I don't think there's any prioritization given to asymptomatic versus symptomatic, not that I'm aware of anyway. And also the same is true with the no barrier testing. They're willing to test anybody regardless of asymptomatic or symptomatic. Those slots fill up quickly. They try to keep some slots available for just walk-in, even though they don't encourage that because it really does complicate the process. But as long as those percentages smaller and they can anticipate that, that is also an option too for people who really feel they need to get it. But you got to drive somewhere. I mean, we had one here in Waconia that you might remember, and we surpassed their expectation. They had the capacity to do 600 tests a day. We did 400 and some the first day, almost 600 the second day, and we were well over 600 the third day. So they were able to use some of the testing from the previous day to do that. And we ended up having over 1,400 for those 3 days. That was a lot more than any of us expected, especially out in Waconia, because people thought that was too far. It wasn't. And that was a 3-day, but that was a one-time shot. And we've worked with Scott County to provide a couple of other one-day events. And we're continuing to look for other ways to expand our availability of testing right now. But again, we still have the saliva testing. There's other ones that are sort of nearby. We're hoping to get one in Shakopee. We'd love to have one back in Waconia. We've been talking with the state EOC to see if we could become a permanent site for that. So we're so hopeful. And it was expanded their testing too, just that not to the extent of need. Sorry, man.
Doc, one other quick question. I've heard that they've changed the quarantine now from 14 to 10 days. If you're testing, is that a correct assumption?
I'd have to double check that. I know my staff who are working with this day to day, they're the ones that are up to date on the latest. Usually the quarantine, once you start symptoms, if you're symptomatic, then it's 10 days from the onset of symptoms and making sure that you have recovered. So you're at least at 24 hours without symptoms and not having to use medication to eliminate your symptoms. If you've been exposed and you're waiting to see if you contract it, I was under the impression that's still 14 days because the incubation period can be that long. So whether or not they changed that time, I'm not sure. But there are the two. There's the 10 days if you have it and recover. And then after 10 days and symptom-free for 24 hours, you're good. But if you haven't come down with it and you're waiting to see if you convert, that I thought was still 14 days.
Okay. And
typically you cannot test out of that quarantine. So if you go in and get negative, does that mean you come back to work? No, because you may not have converted yet. And that's why the test is showing negative. So that's why you still usually are recommended to be out for the 14 days.
Okay, thanks. All right, anyone else for Dr. Scott? All right, I'm here in silence. Well, Dr. Scott, thank you very much for being with us tonight and keeping us updated. I hope the folks at home had the opportunity to listen as well. It was a great update, and I think that it's well worth it. And hopefully, we can at least put your PowerPoint on our community page to have availability to some of those some of that information on there for people to see. So again, greatly appreciate you being here, and I'm sure we'll see you soon somewhere at either back here or at one of our EOC meetings. So
Absolutely. Well, thank you, Mayor Winchell. Appreciate that. Thank you, Council. Appreciate this opportunity to share. Have a good rest of the meeting.
all right, thanks, Doc. Appreciate it. All right, Michael, is there anyone else on for visitor presentation?
No, not that I can see anyone.
Okay, then we will move on to item 6, which should be consent. Get my page off here. Approving the previous meeting minutes. Again, if there are no corrections or additions, I would look for a motion to approve previous meeting minutes from November 16th.
So moved by Hatfield.
Motion by Councilmember Hatfield,
Second by Councilmember Gross.
second by Councilmember Grau. Discussion. Hearing none. Councilmember Hubbard,
Yes. Oh, I'm not on mute. Yes.
Councilmember Wong,
Aye.
Councilmember Hatfield,
Yes.
Councilmember Grau,
Yes.
and Mayor Winchell, aye. So passes 5-0, moves us to now consent agenda items. Again, these are items that would need approval, but not necessarily a conversation. So anyone have any? This is the next downtown reconstruction project for 2021.
I have a quick question on this. I understand the need to do Walnut and Fifth because of, it sounds like the interconnection to the 41 project. My first question is it going to change the look of Fifth Street there at all, or is there still going to be a good amount of parking and such?
You talking 5th Street by the city park?
Yeah. Is that? do
No,
I-
You're talking about by Red Bench Bakery, correct?
And I might be getting ahead of myself, so it's okay if it's like, we're going to talk about this later, Michaela, don't worry about it.
No,
That's-
go ahead. Matt can answer this.
Yeah,
one.
no, it's a good question, Michaela. I would say, in terms of street look, what you could use as a comparable is right across the street from City Hall. So a lot of those treatments and things that were used kind of mid-block, 5th Street, both east and west of Highway 41, that they will look the same kind of generally going into it.
Okay.
Yep.
That's what I thought, but I just want to clarify. And then second, so again, I understand the need to do that part because of how it plays into other things. But with doing the 6th Street Bridge, is there a reason we're not just doing more there? That's like a hot topic for a couple residents. So I thought I'd ask.
Sure. Well, I can touch on just some of the mechanics behind it. So, we're kind of looking towards next year, well, the next 3 to 4 years. So that's kind of where we've moved is, getting ready and prepared for 41, getting ready for 61, how we're going to move traffic through downtown while those two projects are kind of underway. And both of those will be, big projects for the city to take on. With 6th Street, because because we did get bridge funding available, that's the only reason why we would actually go over and do that bridge. There's no utilities that are in the way. We can simply take the bridge out, replace it, and it helps as we go and as we look to the east side. A couple things we talked about is, how do people move? How do people get around? And with the bridge kind of bifurcating some of those residents, specifically Auburn Manor, it'll help at least alleviate some of that traffic, getting Auburn Manor around and getting them circulated through their parking lot. So that was kind of the thought process. There's no real rhyme or reason why we're not could we go over and do some of those blocks? Yes, but this is kind of that preemptive that says we've got some big projects that are coming up, and we got to get some of the businesses kind of aligned with what's going on.
That makes sense. I am probably just thinking about how much work Beach Street Bridge looked this summer, and I'm like, why wouldn't you just do more when you're doing that bridge already? But it makes sense. There's not as much around that 6th Street bridge. So perfect. That's great. Thank you. That's all I had for questions.
So we wouldn't be doing, what is that, Maple Street and Fifth then next year?
Maple Street we've pushed that out for at least until probably next year. We could come back as 61 is kind of underway and, look at more of that easterly half, finishing off kind of the entire east half of downtown is what we look towards maybe next year.
When you say next year, are you talking 22 or
22? I'm
22.
sorry. Yep, 22.
So we would not be working in that area next year.
Just the 6th Street Bridge would be replaced.
Okay. Well, I don't know. Do we put correspondence out to the residents then that we're not going to, so they're not expecting it all year? How do we do that? Because remember we had this at a council meeting and I said that I thought it was slated for next year. I mean, I wasn't positive, but I was pretty confident that we were going to do it.
We can get out a letter to people to let them know what the next 2 years of planning is. That basically, because Matt's right. I mean, the real big push for doing Walnut and Fifth is really to prepare for 41 and 61.
Right.
And to be ready and done with that before we start those projects. But we can certainly, provide notice out to the other homeowners about when they can expect it to occur.
I would like at least get that out. I mean, it's not a ton of residents down there.
Mm-hmm.
But, I know that they've been patiently waiting for that to get done. And I think we owe them that, to send them a correspondence to kind of explain what's happening. I think that's important because it's probably only a dozen homes that it's really going to affect, but nonetheless, they have been waiting for it. And we've been telling them, 2020, 2021, and now it's 22. So I think that at least doesn't hurt to have extra correspondence out.
Okay, we can do that.
Yep. All right. Anyone else on any questions about the feasibility? I'd entertain a motion to approve consent then.
So moved by Hubbard.
Motion by Councilmember Hubbard. Second by Winshuttle. Discussion. Hearing none. Councilmember Wong.
Aye.
Councilmember Hatfield.
Yes.
Councilmember Grah.
Yes.
Councilmember Hubbard.
Yes.
Mayor Winshuttle. Aye. So passes 5-0. All right. Next we move to item 8, which is action items, and this is City Square West preferred developer process.
Here, council members, I'm going to turn this one over to Nate as he's the lead on this project.
Mayor, council members, this is City Square West. We want to propose a way to continue moving this project forward tonight. So just to give you a recap as to where we are today and a little bit of a reminder, council has taken a number of actions that are outlined in the staff report. Most recently would have been this spring. We had a work session early February of this year to outline to you all a process to select a preferred developer at that time. We presented an updated financial model to kind of show how the TIF and other funding sources would play into the project. And then from that, we actually moved forward and we did release an RFQ to identify the preferred developer. So that RFQ went out and was responded to meet the deadline that we had set of February 10th of this year. And at that time, we did receive 3 responses from developers that expressed interest and put some proposals forward. And staff did begin a process of starting to vet those responses in preparation of bringing those to council to eventually select who that preferred developer would be. And to remind you, the reason that we want to do preferred developer is the complexity of the project, the site assembly, the public-private nature of the outcome of the project, where we've got the plaza in the middle and then privately owned residential and commercial spaces surrounding it, all lends itself to really needing to be working directly with the development team through the entire process. So, really from the onset of figuring out how are we going to get through the planning process, and what are we putting forward for design, and what makes sense for tenants and all that kind of thing. And also including going for grants, to the Met Council or other sources that would apply. Those are processes that we really need to be working hand in hand with someone to be able to speak about, what is it that we're doing and what's our strategy, and how do we get to the outcome that both serves the private side of the project, but also the broader public need with that project and desired outcome there as well.
Well, and some of the things, just to give you a sense on grant success, is we need to be able to show that a project is ready to go. That's how you become competitive in these processes. But we also need specifics. We need to understand exactly what the project is and what the cost gaps are, so that we can go out and do that. And without having the developer involved in that process, that's very difficult to do.
And so with that, we wanted to enter into a preferred developer relationship where we're not entering into a development agreement where we're saying that this shall happen, but what we're saying is that the city is going to work with this developer to come up with the details of the plan, go through the process, and sort of set some benchmarks, so that assuming we continue to progress in ways that we all feel are positive, there's some assurance there from both the city side and the developer side that this is something that would come to fruition. And so going back to February, we were moving through that process with the intent to bring things to you in March. And if you recall what happened in March, is
Please remind us.
Yeah, well, exactly what we were talking about in the visitor presentation, right? So I don't need to dive into that again. But at that time we thought, so now seems a good time to hit pause on this and kind of see how this COVID thing develops. And here we are today. And so over that course of time, we have continued to keep channels of communication open with the developers that did submit back in February, with the idea that at some point we're going to want to move forward here, and so hopefully they continue to express interest, and if they don't, we need to understand that as well. They have expressed interest up until this point. And recently we've been talking about, well, what makes sense to try to move this forward. Is this something that there's enough interest in still? And we've received positive feedback from the developer community, or at least the ones that submitted to those questions. And so our thought is, sort of like Matt was talking about the community center, using downtimes to do planning work so that we're set to go when the time is right. And I think that's how the developers that we've been talking to are looking at this as well. They're saying, yeah, I don't know that we would necessarily build the project today, but it does make sense to be thinking about what the project needs to be and what it is that we would move forward on, so that when the time is right, we're ready to be competitive with these grant processes and we don't miss that opportunity. But I think the trick here is that we need these developers, whoever we're working with is going to want some assurance that there's somewhat of a formal relationship there between us and them, so that they can go forward and put the dollars into the project that they'll need to develop this, the plan for the project, and have some level of confidence that, if we can be successful here, that they're going to, see the benefit of that as the developer. If we don't have it in place, there's really no incentive for them to invest in the project. And so what we want to do is move forward with identifying that preferred developer. And so we've reached out to all the three developers. Two have responded positively to wanting to engage in, an interview process. One has since decided that they've got enough going on right now that they won't be proceeding. So that would be Tyson Talley. The two that have expressed interest is Inland Development Partners and Trident Development. Trident, you might recall, did the Jonathan Flats project most recently in town. And Inland Development has, I don't think, done a project in Chaska, but they've done a lot of projects in the metro area and have been looking to do projects in Chaska recently as well. And so what we're proposing to do for a process to go forward here is that we would like to interview these developers I think it's next week, Wednesday. And what we would like to do is have a combination of staff and council involved in those interviews. We're recommending that we would have 2 council members involved in that, so that we're being cognizant of open meeting law. But then the desire would be that, between staff and council, we're able to debrief on those interviews, formulate what our recommendation would be to the broader council and reflect on, the conversations that we had. And then come back at the December 21st meeting with that recommendation for council to consider. And so that would be a recommendation to say, this is the developer that we want to enter into a preferred developer agreement with. We wouldn't be entering into that agreement at that time. That would be a next step that would come after we've identified who that developer is. So that's the process for now that we're thinking of, that we'd want to move forward to identify that preferred developer involving council in that process, and then we would take next steps going forward from there. So with that, I'd open up with any questions that you have or any further discussion.
No questions, just I think it's a good process. I mean, establishing partners early will help us to, you get real numbers and real insight in terms of, current, in terms of approaches and what works, what doesn't, what the partner's capable of doing, and also, what some of the risks are from a cost, labor, what's out in the market, and what the availability of resources out in the market are. So yeah, I think that will be really helpful because, there's going to be a limit to what we can do in-house for this project this scale.
Mm-hmm.
All right, any other questions for Nate? Well, I guess the next part would be about who from council would be interested in sitting on this interview. I have some thoughts based on what others are feeling. I don't know if you want my thoughts first or well, I'll just share them with you. But I see Mike's Taylor's is giving thumbs up. But I had a conversation about this a little bit, but it'd be nice to see maybe John on it because it's his ward. And then Michaela sits on the Downtown Business Council, has been pretty active. And those would be my recommendations. I don't know if that fits in the work schedules for people. And it's certainly open to a conversation at this point. But I just think that with those two covering those aspects of this, I think it's an important part to have that representation involved. One, they can share them for, Michaela can share information back to the Downtown Business Council. John, if he gets any calls from constituents, he sits on it. So that's just my feel, and it's certainly open for conversation at this point.
I was going to volunteer for it. I mean, because, I spent the better part of 10 years involved with the, effectively redevelopment of that block in one way, shape, or form through the downtown master planning process. And also this, the city planning and redevelopment, as we were the ones who identified that as a catalyst site for redevelopment as well. But, I'll defer to the group in terms of what makes sense. So.
I was not volunteering for that committee.
Oh.
I was giving you a thumbs up to tell me your opinion. So
Oh, okay.
you guys can have at it. I was not volunteering for that.
Yeah, I mean, I would definitely like to, just and Councilmember Wong has been at some other meetings as well. So this is an important project for the Downtown Business Alliance and what they get to hear about it. And so I'd love to be able to represent. I obviously love downtown too. I'm like slightly obsessed with it. So there's that.
That's good.
Yeah, I think like I said, just logistics, figure out what it is. And I assume it's probably via Zoom and the use of technology again, which makes things easier because cuts down travel time and everything like that. So
Yeah,
any
just-
sense of, it says in the afternoon of the night.
Yeah,
Any
so
sense of-
basically the interviews would be at 2 o'clock and at 3:30.
Right. And then we would plan for a debrief to follow the 3:30 interview. So
We
you
could
know,
probably be done by about probably 5 to 5:30.
yeah.
Yeah.
Yep, you can include me. I can make that work. That's not a problem.
And I should point out Kevin's a big part of this too. He was just hiding before I didn't see him.
Mark, it looks like you may be talking, but you're on mute.
Sorry. I was just gonna say if the rest of the council is comfortable with this, I think it's the way to go. Mike, I appreciate that your willingness, and I know you've been involved with it, and maybe at this point it's good to have different eyes as well. So if there's no other objections, that would be my recommendation. Then Michaela and John be serving as our council reps. Everybody's good?
You should vote on it.
We should vote?
Yeah.
Okay. Is there anyone that'd make a nomination that we approve Councilmember Hatfield and Garrett to be our reps on the, what's it called officially?
The City Square West Interview Committee.
Yes, not just what he said. Is there anyone that'd make a motion to that?
I'll make a motion to it.
Okay, so I have a motion by Councilmember Wong
I will second that.
and second by Councilmember Hubbard. Discussion. Hearing none. Councilmember Hatfield.
Yes.
Thank you. Seeing you made a motion. Councilmember Gra,
Yes.
Councilmember Hubbard.
Yes.
Did I say, I'll go to Hatfield then this time.
You were. You went.
I'm so
there.
confused. I think I accidentally voted for Wong.
I said Hubbard twice. So I'm going Hatfield.
Twice.
I could swear you said after.
That's to keep you guys on your toes and paying attention.
I'm confused.
You said so many names.
So
Yes, again?
Councilmember Hatfield, are you saying yes?
Yes.
Okay. Then we're all back. Councilmember Wong,
Aye.
Mayor Winchell, yes. Passes 5-0 or 4.5, just depending who you're looking at. So that pass. So we have our council reps.
And the one thing I'll mention is there is going to be plenty of opportunity to be involved in this whole process. So,
This is
even on this interview process, it's going to be a recommendation to bring a developer back to the council. We would anticipate at that December 21st meeting that whatever recommendation we're bringing that developer also to the council meeting, so that they have an opportunity to answer questions and talk about sort of their approach and things like that. So
we would probably have a work session on that.
no, probably not a work session because that's sort of the point of having the interview. But
Okay.
it's going to be a lengthy enough item where, this is a big project. People are going to want to talk about it. So.
So is that all we needed? Do we still need to vote on the process, on moving forward with the process then too?
No, it was just getting that part rolling.
Okay, okay. All right, so at that point then, we're gonna move here, because we got a new item on here that I don't have on this written one.
It's actually under other business. It's
Okay,
after bills.
and so now we'll do the bills. We'll do the bills first. Any questions or comments or whatever on bills at this point?
I have
Okay.
some. Let's start with page 1. Under act, was it Afflaction
Well, that's
Holdings?
easy for you to say.
Appalachian.
Afflaction Holdings.
Aflac.
You know, he's quacking me up. So there's an annual subscription fee. Are we moving away from this vendor? Because it sounds like it's for the website, if I understand correctly.
It's
It's
not. No, it's actually for our active.net system, which is our registration system for both the curling center and the event center and the community center.
Okay. Because that's the system where people can register for like either tea times and stuff like that. But that's not getting rolled into the the Civic Plus stuff. The Civic Plus doesn't handle this type of stuff.
No, they basically create a connection to it from the website.
Okay, so they can like interface, but they're not going to replace one another.
Yep.
Okay. Okay. Second question is on page 5. There's one for Copperwood Management, and I know it's just a business like rebates. What is this for? Which building are we talking about?
It's the building at 125 Columbia Court, which is sort of backed by Apex back there. But it was basically a lighting rebate. So changing out light bulbs for efficient light bulbs.
Oh, okay. On page 5, this is more just a comment. One of the things, this is one of those things that kind of bugs me. It's just says non-stock supplies and just non-stock. It doesn't say what it's for or anything. It's just it's more just it's awfully generic, and it's like, stuff like that troubles me because it's like, it doesn't say what type of, even what it's fulfilling, what it's being shelved for or anything. It's just stuff like that kind of bugs me from an accountability transparency perspective.
Yeah, keep in mind that some of this is getting down into literally nuts and bolts and things like that. There's only so much we can break down exactly what that inventory is, but they said they can look at some of sort of the bigger categories and try to classify that. Which
is totally fine. I mean, just what it says supplies, that's, it's too broad of a stroke.
Yeah.
Page 6 under MP systems, there's one in the there's an MRS breaker for, what was that for? It's a construction.
So we installed a 4th breaker at Minnesota River substation. It was actually down for about a month and then brought that back up. That's actually something that's was actually being funded through MMPA, but we actually did the work. It was needed because we found, and this was actually a couple of years ago, we found a weakness in the system without having that 4th breaker between the tie of the turbine and the actual substation itself.
Gotcha. Okay.
And the reason we had to wait till now to do it is because until we had the new North Industrial Station, we didn't have enough substations in the community to be able to just shut one off for a month period.
Oh,
so that's why we waited to do it till now. Now that we have the North Industrial Substation up and running, we have the ability to have one completely out of service now so that we can actually do preventative maintenance on it and move it around. So that's a huge benefit to us now.
We're actually generally speaking, so from a electrical substation perspective, we're in a much, much better state than we were like a couple of years ago in terms of just like outages and things, just because we have that redundancy of this extra substation.
Yeah, we always were significantly higher for percentage of uptime than Excel, but we're even better now.
Yep. All right. Like to hear that. Page 17, SRF Consulting Group. There's one for the 212 interchange, and I'm guessing it's Big Woods Boulevard, right?
Yeah, it's big. It's some of the ongoing work with Big Woods Boulevard.
Okay. And then page 18. So page 18 under 1040 Ford. It looks like we got a few new police vehicles. So are these the new like hybrid utility vehicles?
They are not.
These are
The hybrid ones cost about $4,000 more,
uh,
and we couldn't justify it economically to get them.
okay. It's kind of funny because the way they advertise, I went to their website and took a look, and it looks like that's the only thing they sell, but clearly not.
Yeah, yeah.
Yeah. Okay, and then on page 20, last one is there's an item for Yosef Ahmed. It's a meter deposit refund. So this one's like a $3.08 item, and I'm wondering, it's like, is there like an administrative way to kind of handle this, given that, you know, to handle like all the processing and stuff and with everything else? I'm guessing that stuff like this is maybe costs just as much as that $3 or whatever. Just, you know what I mean?
Well, we have to provide the refund.
Yeah, absolutely.
Yeah, but the you know, the processes, yeah, we can look into that. We'd have to make some policy changes though with the council, because technically you guys are set up now to approve all bills. And so we'd have to change things, our system, do that. The finance department said they are looking into what exact policy changes we need to make. We do that for approvals right now. So like, for instance, I only approve things that are over a certain amount. And then finance actually approves things that are a certain amount or less, just because of the sheer quantity of bills that we have. But we can certainly look at that from a council perspective too.
Yeah, I was just thinking both from the efficiency and the cost perspective, because I mean, I worked at companies where, like, you know, money was free flowing versus on the other hand, the companies were struggling. And if you wanted to FedEx something, you had to get the CEO to sign it. And it's like, you know, it was, you know, there's like challenges on both ends of that spectrum, but trying to find a happy medium where, you know, things like these, I mean, it's something, you know, less than some reasonable kind of petty cash amount. Like, how can we make that easier for everybody? Yep. Okay, that's all I got. Thank you.
I think you're on mute, Mark.
So at this point, I would entertain a motion to pay the bills then.
So moved by Wong.
Motion by Councilmember Wong,
Second by Councilmember Grau.
second by Councilmember Grau. Discussion. Hearing none. Councilmember Grau,
Yes.
Councilmember Hubbard,
Yes.
Councilmember Wong,
Aye.
Councilmember Hatfield,
Yes.
and Mayor Winchell, yes. So bills pass 5-0. Now we go to, is this just going to be open discussion under that? Or is it going to be part of other business, Mike? I don't know who's discussing this.
No, this was. I'm thinking. I think this would just be something I would talk. I asked to include the link as a reference when I talk about my regular other business.
Okay. Well, why don't you just go ahead and fire away?
Okay, sounds good. So for other business, you know, just want to, you know, certainly want to wish everyone a happy Thanksgiving. That was passed already. And, you know, hopefully everyone's happy and healthy and getting back into their work week again. There's a food distribution event upcoming on Thursday, December 17th. That will be at the Gedney location. And of course, if people are willing and able to volunteer, they're always looking for more hands to help out with that. The item that I asked to be included on the agenda was a link to the Met Council's Blue Ribbon recommendations draft. So this is currently a working document of what the Blue Ribbon Commission's currently thinking. That said, you know, just from a summary perspective, it's from the points that we're focused on are the regional transit ones that affect Southwest Transit. There's a number of other things that I'll let you kind of read through it if you're interested in the other two items about Met Council governance. But related to the Southwest Transit impacts, the summary points for us are that, you know, there wasn't a widespread call to dismantle suburban transit, which was really good for us. There was support for the support for expansion of suburban transit wasn't really, is certainly, wasn't included within that. So it wasn't one of those things where we said, go ahead and, continue expanding or growing. And they certainly didn't advocate, and they certainly discouraged new transit agencies from forming. So, at this point, what the recommendation is kind of generally to keep things status quo, but to continually reevaluate financially where things are going. Now, that said, this recommendation is still subject to some more discussion within the Blue Ribbon Committee, and that may change. It could go one way, it could go a little bit another, but at least this is where it's currently at. This is their first pass at it. But I want to make sure everyone has some visibility to it, because I know we've been talking about this for the past few months now. There was general support for improving the funding streams for suburban transit, which was good for suburban and the metropolitan area transit. And that's really important, because I think that all of the Blue Ribbon Committee generally sees value in regional transit as a whole, which is really important. And there's certainly a call to drive for more efficiencies, because that's an area that was kind of a weak point of having multiple transit agencies. So this kind of leads into one of the other points that I want to talk about, which is that that MBTA and Southwest Transit have started discussions for a merger of the two organizations. So we've had the first conversation with the executive committee from Southwest Transit and executive committee from MBTA, and MBTA serves like Dakota County and, including like Eagan and Apple Valley in that area, and that as well as through part of Dakota County and including Shakopee and Bloomington, that area. So, Savage, not Bloomington. So between MBTA and Southwest Transit, right now we're at a point where we've at least had that first conversation. The general takeaway from there was that everyone at the table seemed to be interested in continuing the discussion moving forward. There seemed to be interest. The pros and cons to the outcome of the conversation were, the pros were that with a larger number of constituents and representation from Southwest Transit in terms of, primarily Carver County and the 3-member communities there, added on to MBTA would give a greater number of constituents and representation. That gives a little bit more political leverage within the capital as having a single organization. There's also increased negotiation power that goes along with that in terms of, not just, political capital, but also the ability to leverage for like larger, for like collective bargaining agreements, or even, in terms of, acquisition of buses or equipment. And the increased efficiencies of scale with that. Generally speaking, it's a pretty good culture fit between the two organizations, but some of the cons are pretty significant, or things that we need to work through in terms of, there's a very strong identity within the two organizations, and there's a concern about that loss of identity, that loss of, who's Southwest Transit and serving the member communities, because we're very tightly tied to Southwest Transit. And likewise, there's one of the things that both organizations, and especially Southwest Transit, pride themselves on is the ability to innovate. So because we're relatively small, we can, take chances. We can, be very lean and say, you know what, we're going to take this opportunity to try, like something like microtransit before there was a name for microtransit, or we do electric point-to-point buses, or try automated vehicles. So those are things that, like we are always on kind of the cusp of pioneering, and, we don't want to lose that. So that's something that's also like a concern for us. But probably one of the largest concerns for us is that is the governance question, because since we're much smaller than MBTA, we also have, fewer voices, fewer governing bodies, so to speak, or a much smaller governing body. So the question is, like, would we, how would this governance structure work? Because we're comprised of 3-member communities, between Chaska, Chanhassen, and Eden Prairie. And within MBTA, there's also county support too. So there's, county representation from, Dakota and Scott counties. So it's kind of a different sort of dynamic there, in addition to those member communities. And so then there's this question of like, well, how does this fit in? How does the governance structure work? And there's also funding questions too, because I think some of their funding streams are a little bit different than our funding streams as well. So there's a lot that's still left to be worked out. but I did want to make sure that everyone was aware that this is an ongoing conversation right now, and we're continuing to edge forward because, given that the kind of the ongoing challenge from people who don't believe there's a value in regional transit or suburban transit providers, there's definitely a consensus amongst the leadership teams and certainly the boards and commissions of both organizations that we do need to at least collaborate together and potentially consider this merger as a defensive way to protect our community's ability to make our own transit decisions and to have more input over our own transit funding. So I'm just going to stop there and kind of give you a chance to ask questions if you guys have questions for me right now.
I heard you kind of say it, but one concern would be to just anytime their MVTA is larger than Southwest Transit, correct? So combining something like that to ensure that there's still equal, however you do that, to make sure it's still equal, that Carver County, Eden Prairie, that those unique needs are still met. Burnsville, Egan, I work out that direction, so I drive by all that. Well, when I went to the office all the time. And I think that as much as we're a little bit still unique, they have much more direct access to things like downtown with their roadways and such in most of those communities, not all, but things like that. So just ensuring that, conversations, if they went forward, that there would be some way to keep the unique needs of our area from getting drowned out in the future. We always go in with good intentions, but that would be just, and like I said, I think you kind of said it in the potential cons, and I don't mean to just go straight to a negative thing, but that when listening, that was kind of my concern, is to make sure that we still are going to have our needs met, I guess. And then of course, you also mentioned it, just like the it's almost like a brand recognition. You don't think of transit as having a brand recognition, but they actually both have really strong brand recognition. I think Southwest Transit's done phenomenal with their brand recognition, and that plays into ridership. Southwest Transit has really nice buses. And I'm just talking because that's what I know. So you see those black and green buses, and you're willing to get on them because they put out a quality product. You're not going to get on a crummy bus. So I think that's important too. And like I said, you kind of said it, but those are just my thoughts.
Yeah, absolutely. 100% agree with you on all of their points. Those are real important concerns to certainly myself and, certainly our peers on the Southwest Transit Commission, for sure.
I would definitely echo Councilmember Hatfield's comments. I think it's very important, but she didn't quite get there, but I think it's the identity factor. Is that identity factor going to stay there and be there? And I really think that at some point, Southwest Transit needs to really sit down with the city administration and have these conversations and have a serious talk about really what's happening and what's going on, and really know from, is it still going to continue to meet our needs as cities that these three cities have really helped mold, as Southwest Transit has molded us to their services. But to just all of a sudden have these negotiations with MVTA, it's just kind of surprising that we're not getting some conversation along with that from Southwest Transit admin and meeting with the three cities admin. I think that that's an important step that we're missing here, and I don't want that to get lost, because like I said, it goes back to all the points that Councilmember Hatfield talked about, but ultimately it's our identity. It's our bus service, and I don't want to lose that either. But I get it, but I think we as cities need to start getting involved with that in a more deeper phase of what's happening.
So, and just to make sure that we're on the same page too, there's only been one meeting, and that was just a first introductory meeting, because that's based on the last conversation that we had. you said we're going to have the meeting. That's the only meeting that's taken place so far.
Okay.
Yeah.
Well, I don't want our cities to get left out of that. I mean,
Yeah.
that would be my thoughts on that.
Yep.
We need to stay involved as even though we're at baby steps. I think we need to start understanding what's happening.
Yeah, and that's one of the reasons why I wanted to make sure that I gave this update to you guys. You have complete understanding of what's going on, at least from what I'm seeing out there, because this, I know it affects our community deeply, and this is important to all of us, and that's why I want to make sure that I gave this update to you guys. I didn't want you to get blindsided by it. I'd rather you hear it from me than hear it from see it in the newspaper somewhere.
I appreciate that personally.
Yep.
I've really been grateful for you keeping us in the loop on those things. Like I said, I've said it a few times, but I'd have no idea if you weren't kind of keeping your thumb on that. So thank you.
Okay. Anything else, Mike? Or are you good?
No, that's all I have.
Okay. All right. I'm just going to go around the way they are on my screen. So, Councilmember Hubbard.
I don't have much, just this a plug for, I suppose, shopping small, especially during the shutdown with some of our businesses not being able to be open fully. And just our small businesses, just in general, just with the year, I think we all kind of share the same sentiment as far as shopping small. I was able to go out on Friday, and the Downtown Business Alliance, some of the businesses had like ornaments if you spent over. So I got my Chaska ornament, which was on my tree until the meeting here. So I just think just supporting our local businesses in any way that we can is kind of my pitch today as far as my message. Otherwise, I don't really have anything else.
Okay. All right. Good. Thanks. Councilmember Hatfield.
I don't have much. I was gonna mention as well, the shop small, support our restaurants. I had Thanksgiving dinner from Dangerfields and Shakopee, and it was delicious. And it was nice to support a restaurant, and I would have spent more trying to make it myself. So, and yeah, like Councilmember Hubbard mentioned, the downtown businesses have the Love Chaska ornaments, some of the participating ones. They got them last week. So if they still have some, shopping those, I think they vary on what the purchase is to get one. And they believe some of them have masks too. So kind of a fun thing with that Love Chaska logo they came out with earlier this summer. And they also have the 5 for $25. And I was trying to pull up the details again, but it's on their Facebook page, basically just committing to spending some money in 5 downtown businesses, and you can be entered to win some prizes. So check that out on their Facebook. And then they also have some photo ops in the city square with a Santa and a snowman. They're, I think, 5 foot. So your kids next time would definitely look adorable. Or you, I plan to go just take some selfies probably next week. So there's that. And then I think that's all I had. Yeah, that's all I have.
Okay, perfect. All right, thanks. Councilmember McGraw, you made it through the meeting.
Yeah, I did. I know Kevin's hopefully still listening, so I'm gonna put him on the spot. Hey, I got a question regarding my neighborhood in regards to the development to the east, south, right? That was earlier in the topic with access. I talked to my connections on the planning commission. They haven't seen anything. Any update of where that's at or where that's going at this point?
Yeah, we've been working with the developer, trying to look at the different issues that were brought up at that time, and they're still working on it. They've been also working with the property to the east of there as well, the Roebling piece, trying to pull that all into one. It has some of the same issues, and from the neighborhood has issues as well. So trying to bring those together and trying to bring the 2 property owners together. And so they've been working on it. It's not an easy process. when you have a small project like that and multiple property owners and lots of things going on. So they've been pecking away at it slowly. We just met with them last week, talking about that in a little bit more detail, trying to get them, to a stage where maybe they can come back.
Okay. Yeah, I was just curious. I got asked this week by a neighbor, and then I reached out to another neighbor who's on the planning commission and said, "Hey, have you seen anything in your packets?" And they hadn't seen anything yet.
No.
And obviously I knew there was some, and they did meet with the neighborhood. Don't know when that was, summerish, outside at a socially appropriate distance outside venue. But I know there was wetlands and grades and slopes and all that kind of stuff.
Trees and everything, right? So, and access and lot size, and so they have a lot to try and manage, and it's not a very big area to manage a lot of that stuff. And so they're working and they're trying to make progress, and I give them credit for sticking to it, because be probably an easier one to walk away from. And so they've been, trying to show that they're capable of, getting it to the finish line, which would be good for everybody. And so they're continuing to work on it, and we'll have to see if they're able to make the plans and economics work, for both of the parties involved. And if they can, then we'll probably see it again.
Okay. That was your test to see if, make sure you were still listening. You passed.
Because I was going to ask that question, if there's been any meeting with the neighborhood up there. So you did have one.
There was. It was shortly after. It was late summer. I can't exactly remember.
Did that go okay? Did that
I believe it did. I did not personally attend because I just felt it wasn't probably in the best interest for me to attend with my role in the neighborhood. It was literally across the street, so I could look out my window and see who was over there. But what I heard from the neighbors is that they listened, and I think they got good feedback. Now, I think not a much new was shared that wasn't shared with them, when they were met with the council. Obviously with, like I said, as we, not to rehash it, but safety, access from the neighborhood and traffic being, highlighting some of those concerns. So, but no, they did follow through pretty quickly with that request, and it was appreciated by the neighborhood.
Okay, good.
Second thing I'll just say, I had the privilege to speak at the Southwest Chamber mayor's meeting. I will never replace Mark, but I thought it went well. I was most informational. I'm not saying this just to pat myself on the back by any means. I just really want people to go actually and watch the video and read some of the information out there, because it was really informative to understand what's happening around us. Because especially as a council member, I'm very in tune to what we're doing, obviously, but it is interesting to hear kind of what I know. Councilmember Hubbard was on, watched it as well, just to see what's going on in the neighborhoods. And, COVID surprisingly was a good topic for everyone, but just kind of the development and the needs and everything like that, particularly like myself, where I personally live right on the edge of Carver. It's always kind of interesting to know what's going on with Carver. So just kind of a shout out to the individual, for people to, council members, you haven't watched it, to watch it, as well as the community to watch it, because it is kind of nice to understand what's going around and what's happened. I think COVID dominates everything we do right now, but a lot of other stuff happened and is happening, and a lot of change and good change and challenges, but overcoming those challenges from all the cities, and it was appreciative. I was also appreciative. Representative Dean Phillips attended as well, and kind of gave an update on the small business aspects and trying to get some COVID relief packages, which was appreciative. So I like I said, and I didn't have time to do a quick count, but I think it was pretty well attended. I don't know, comparably speaking, to if they saw a difference between in person and Zoom. But it wasn't just us five talking, so that was good.
Well, thanks I do appreciate you filling in, but we had a pretty strong tab meeting that definitely needed some input on, and it really worked out beneficial for the city of Chaska and Carver County. So that was very fortunate. It was the groundwork, and then we'll actually vote on it here in December. But so appreciate you filling in for me. And yeah, it's always informative. That's the biggest event the chamber has. Normally the event center is full. So, you know, it's unfortunate we couldn't do it live. I know they were gonna try to, but it wasn't the right thing to do. That's not the place to put all those key figures there in that one spot, so. But thanks for doing that. And that, I assume that's on YouTube and our communications. I assume I know I've looked for it, but not real hard yet. I saw part of it, but I haven't seen it all yet, so. Oh, here comes Kevin's got an answer.
We only have our part recorded. We will be sharing that here once we get it up on YouTube. So we'll make sure to share it. But unlike past years where it was in our facility, we didn't, we only recorded our part just because we knew Councilmember Grau would approve of that.
Well, I approve of it, but I'll never watch it personally, just so you know.
We'll all watch it for you. I already told the mayor that he got
Your dad did
flack for skipping.
Yeah.
He did. He did.
They always pick on me. I don't know. Even when I'm not there, they pick on me. Not
They
right.
did do a lot of teasing of you, Mark. So
I know they do, but I get them back. I get even.
That's why he's so interested in seeing it.
I'm sure it is. All right, two last things. Just want to, appreciate and throw out admiration for the Eastern Carver County Schools and the administration and all the teachers. My experience with my children right now with distance learning is night and day different from the spring, and that's good. It was rough in the spring, but obviously no one saw it coming. I am very impressed with kind of what they're doing and the setup. My son got quarantined from club care again previously. He's back now. And so I was home with him, and he's 8, and I heard nothing really from him. Like, I would check in and he's doing his work, and it is a lot of screen time, but they're with a teacher, they're with interaction. So just an appreciation for the time and the effort and the hard work that these teachers and administrators are putting in, because I would say that I've been very impressed with the outcome. Now, obviously, everyone wants their kid back in school, and hopefully we'll get there in the spring. But, so far, a week or so in, 2 weeks in, roughly, just wanted to give a shout out and appreciation, because I have found it by observation just wonderful and very impressed with kind of what they're doing, and they're engaged. I think what they heard loud and clear in the spring was a hard, lack of engagement to keep the kids engaged. And, I just been very impressed with, I could sit my 8-year-old in a room and second grader, and he didn't need anything from me, which was completely different than the spring. So just an appreciation for that. And then lastly, as we listen to the visitor presentation on kind of COVID, just a warm thanks to all those frontline healthcare workers and nurses and doctors and everyone who is in a situation where they're an essential worker and is being called on a daily minute by minute basis to put their life at risk, truthfully, with the COVID virus. And so I just an appreciation for all of those interested, and I think I do this every meeting. I plead for our public to kind of do the right things and wear a mask, keep social distance, limit your gatherings, and kind of do those little things, because it does directly connect back. As we saw the numbers tonight, if really come January, we want our kids back in school, we want to be in a better situation with our state and our restaurants and our gyms and the community center, and really just giving the relief to these workers who've put countless extra hours into ensuring our safety and taking care of patients, and coming home with tears in their eyes, as he described. Just an appreciation for that, because it's we all got to do the right little things to do so we can all make a big impact in the end.
Thank you. Anything else?
That is all I have.
All right, I'll go around. Mr. Clark, you got anything? Kevin, right? Luke? Got to unmute. Unmute.
Unmute.
There you go.
Matt, can you give me a call in the next day or two, or can we have coffee?
Sure.
You name it.
Yeah, I'll look at my calendar and figure it out. I'll give you a call.
Okay, thank you. Otherwise, I have nothing.
Thank you. Nate? Matt?
First of all, it's shop big, small. So, because you want to shop big at a small place. But the other thing, we have the 100 Club on Sunday. And just a reminder that it's a distance virtual event this year. I have 3 tickets left. So if anybody's interested in purchasing a ticket, they're $50 cheaper this year because it's just the drawing that we're having. Let me know by Friday morning at 8 is when I'd need to know. You can just drop me an email or a text. But it goes again to support the all the holiday decorations in downtown. So other than that, that's it.
Okay. Just a few things. Mr. Clark, I do have a question for you. I drove Stoughton Avenue and in front of, I'm sure you know where Tom Kochka is, right?
Yeah.
We put a speed limit and a no parking sign, but right in the middle of that sidewalk. Isn't there something we can do? I mean, that eliminates down the future if we decide we plow with a low plow on the sidewalks. They can't get around that. It's just, it just really looks bad.
The
So
speed limit sign, I noticed that the other day too. There's a couple things that we need to look at with where the location is. When we post it, because of where the sign is, we can move. We have some leeway there, but I agree with you. We need to look at where that speed sign is.
it just looks
Yep.
like, it looks like we didn't know what we were doing. And I mean, we tried, you try to get the
Wait,
sidewalks all
You're talking
squared
about
away.
Matt.
Huh?
You're talking about Matt.
No, I don't know who made the decision where the signs go, but it's just not, I don't know. I think we can come up with a better solution. We don't have 30-mile-an-hour speed limits other places. We can put it down the road further, something, but we got to get that sign out of that middle of the sidewalk. I mean, I could see a kid just riding his bike right into it.
Yeah,
Just-
I noticed the same thing the other day.
I mean, it's so tight there, and then to put a sign in the middle of the sidewalk, it just didn't make sense. So,
Yep.
But thanks if you look into that, that'd be greatly appreciated.
You bet.
I too want to echo that, make sure that we do go around and shop the businesses and get out. And we talked about there's photo ops down in City Park. As we move forward, there's going to be pop-up things happening in Fireman's Park. So you're just going to have to stay tuned to communications and things like that. After the holidays, there's going to be ice sculptures down in Fireman's Park. So we're going to have that happening. I think that'll be pretty cool and give people the idea to get out and walk the park and do things like that. So lots of new people have been very creative with the COVID. While a lot of things have been canceled, unfortunately, they've been creative in other ways. So looking forward to that. The big tree, normally that's a very big night right after the 100 Club. We did a little virtual setting and did the lighting and then tied it. Kevin then put up a nice little video of that. So thanks for that. And so it was unofficially lit Friday night. So the big tree is up and lit already. Next meeting, so we'll have a meeting next Monday right away again. And then the 21st is our, the 7th is truth and taxation, right?
7th is truth and taxation.
And-
The 21st is when we actually adopt the budgets. And the
21st is when we adopt a budget. So if you got any comments or questions, call Councilmember Hatfield. And then lastly, I just want to touch, it's COVID, that's all we hear. If you're joined our meeting late and you really want to get information about what's happening in the county, please review this. Dr. Scott from Carver County was on. He gave us a pretty thorough review of kind of what's been going on around here and where we're at with numbers and things like that. So if you're looking for information, I mean, he was with us for nearly an hour. That's a big task to keep him in one place for an hour, as busy as he is. So please, if you're interested or have a question, please review this. This generally comes out in the next day or so. It'll be on YouTube or on our communication page, and you can pick this up again at a later date. So at this point, last call for anyone else. Otherwise, I have nothing else, and I would entertain a motion to adjourn.
A quick question and a motion is that next week's meeting, there's no work session, correct?
Correct.
Okay, sounds good. So I'll make a motion to adjourn.
Okay, so motion by Councilmember Wong. Second by
Hatfield.
Second by Councilmember Hatfield. All right, so we are Councilmember Hubbard,
Yes.
Councilmember Wong,
Aye.
Councilmember Hatfield,
Yes.
Councilmember Gra,
Yes.
Mayor Winchell. Yes, we are adjourned. We'll see you Monday night at 7 o'clock right here again. Thanks everyone for joining. Have a good
Thanks.
night.
Bye.
Everybody be safe.